For your fantastic presentation.
Okay.
Liedma.
Pleasure.
Ora vi introduco, invece vi presento il professor Daniele Raggi. Ok. Ora approfondiamo il tema delle frequenze e della biorisonanza parlando di posturologia. Ok. Il professor Raggi è posturologo, anche lui ha, come dire, una competenza veramente di grandissimo spessore e io lo chiamo il mio raggio magico, lui è il mio posturologo. Okay? È una persona, al di là della grande competenza di magico non ha niente, ha veramente una profondissima conoscenza del corpo, delle catene muscolari, di quello che accade, vi farà vedere dei video e cercherà di mostrarvi come le emozioni, le frequenze determinate dalle emozioni possono alterare la postura e quindi lo stato di salute. Io non voglio aggiungere altro, lasciamo parlare il professor Raggi, godetevelo fino in fondo.
Grazie. Grazie. Buongiorno a tutti, in attesa della prima slide che dovrebbe partire, quindi non è ancora pronta. Volevo introdurvi un pochettino il concetto, stravolgendo un po' quello che era la mia presentazione per accelerare i tempi e così dopo sarà più comprensibile il percorso che faremo insieme, riguardo a quello che è stato il mio percorso. 1975 inizio lo studio del movimento umano, nell'80 comincio e incontro il mio maestro, François Mézières, una fisioterapista francese, molto famosa e rinomata in tutto il mondo, e che mi appassiona nelle sue teorie e nel suo metodo. E così comincia la storia del metodo Mézières per una quindicina d'anni. Nel 95, visto che parliamo anche di emozioni, per uno strano, inaspettato e violento conflitto emozionale, mi trovo a cambiare il corso della mia vita. Faccio in palestra ciò che avevo sempre criticato, che avrei sempre detto sbagliato, e mi trovo a fare qualche cosa di insolito. Faccio un esercizio strano, succede uno scherzo con un amico, mi salto sulle spalle mentre ho un bilanciere sulle spalle, grave lussazione sacroiliaca sinistra e il sacro non rientra. Faccio di tutto per circa 8-9 mesi, i trattamenti più delicati, dai trattamenti più forti, dai thrust più violenti, nulla riesce a rifar rientrare questa lussazione. Lussazione che mi porta ad essere più o meno in questo modo, a non potermi piegare per nulla e al massimo percorrere da lì a qui e poi dovermi sedere per i dolori lancinanti. E così per tutto il tempo. Dopo tutto questo tempo di tentativi a vuoto, per un attimo comincio a pensare che non ci sia più opportunità e possibilità di ritornare a funzionare. Avevo 42 anni e a 42 anni mi sentivo come uno di 80 inoltrati. Se non che a un certo punto, sfruttando i principi del metodo Mézières, decido, conoscendo che la gravità è la più grande forza che noi conosciamo e che il terreno è il più grande terapista che noi abbiamo. E mettendo insieme i due elementi, visto che noi siamo in mezzo...
And so I managed to modulate strength and counter strength to different surfaces in the space. I was really in pain. I couldn't sleep at night, so I decided to use these surfaces at my home, and something magical happened. In 15 days, I start walking again. In a month, I start running, and then I am straight again, and I am functional again. And this is the idea of a tool, a simple tool, strong, that had to be used with knowledge. And this is what I called Raggi method. This is an idea that was developed from Mézières, who was also my teacher. And so the aim was to help all those victims of non-functional systems as happened to me. I wanted to offer them another opportunity that I had to create for myself. So I created PancaFit that we will see right now. If it works. Here we are. First of all, I have to thank you, Lorena, for this. Our body moves through muscular chain. There are no doubt about that. We know that the muscle is our power engine, but the muscle wouldn't work by himself. So we organize ourselves in an intelligent way through chains. There is no doubt that we aren't simple muscle chains. We are much more articulated than that. But however, we answer as resonators to physics laws and to everything surrounding us. So muscular chains are an intelligent system of muscles organized by a central unit. So we move in a refined, organized, and aimed way. Muscular chains are a sequence of, let's say, motorways that are traveling within our body, not in a linear way, as sometimes they have been described by many authors. This is true on the corpse, but not on the living person, because we have a unique skill to organize in a unique way. So we organize ourselves in an individual way. So these chains are articulated and they travel through different parts of our body. So they move with frequencies starting from 300 hertz and to this level, for example. So they travel with frequencies, different frequencies, and specific emotions may strike me in different parts of my body, creating different resonances. How do we form ourselves with life? Gravity starts acting on myself when I'm born. Gravity pushes me but gives me the possibility to react. So we probably went from quadrupedalism, that is the baby, to bipedalism as an adult, which has advantages and disadvantages as well. Also, our culture forms us. The way we learn, we approach in different ways to the environment. And then there are the trauma, which is really, really important. Every trauma that we have provokes us an adaptation that remains in our memory in a specific area where we are hit. Every behavior is engrammed. Our body doesn't forget anything, but they just add up over time. In function of this, we have an adaptation and we structure ourselves. For example, just as these roots, because they are creating space between stones to find nourishment, we do exactly the same thing. And we will see in details how we do that. So muscular chains are the essence of movement, but if they are blocked, they are also the essence of our pain. We stop working properly, and we have consequences on the energy level, fatigue, pain, urges, and immobility. And we cannot forget the diaphragm. This morning we had an interesting meeting with and we have almost the same principle of Professor Buteyko. The diaphragm has an incredible power to collect all information. It records everything. For example, I will say a sentence in a really low voice. Pay attention. Do you have a diaphragm block? Everyone is holding their breath. I'm just provoking you, don't worry. But I wanted to prove you has such provocation and a request that is stressing you and with this stress, you already blocked and you suspended the diaphragm. Let's imagine that we have stress in our life, which may be higher and over time, extended over time. And this gives power to modify the position of diaphragm and the way to breathe and move. This is not about breathing as itself, but a mechanism that the diaphragm has within chains. It is the epicenter, is the core of every chain, because every chain starts from the diaphragm. So it is really important. It is a fundamental part of the postural system. It is the core of chains and a parachute for emotions. The diaphragm feels everything. It's 36 years I'm doing this job, and in 36 years I see the same episodes over again. It's not true that muscular chains have age. Until the man is walking, we will have always the same laws. We may change our mind. For example, in the 90s, there were some articles written in a certain way, and we say things that were said 1,000 years ago. So what ages is the way we observe phenomena. Diaphragm is also a sensitive muscle, tireless. It is friend with the heart. It is interconnected with it, and it contains tensions and emotional cysts. And so I will tell you about a personal episode. I wrote scientific research a few years ago in a journal about an amazing case, 1985. Parents with a young girl come to my praxis, and the parents are desperate because for a few months their daughter has been having problems going from headache, then back pain, and after a month, thrush, really severe thrush to the intestine, and then the knee is hurt. She cannot put down her leg because she has, no, sorry, I was talking about her foot. She has really pain in her foot. All the investigations are negative. We cannot understand what is going on. And after a while, I gain her trust. I put her on this modulator of space that puts the chains in tension because the surfaces can be regulated. As when you tone the guitar chains, you adjust the chains of a guitar. So we find the frequency of the subject that is useful to readjust the frequencies. So she starts breathing again. There are some exercises. After half an hour, 45 minutes, she holds her feet close to the ground. And the next day, I call the parents, and they tell me that she has left during night. She didn't go to school. She wake up screaming for incredible pain in her foot, in the back, and also for headache. Everything ends with crying, and she remembers an episode that for exams at school the year before, since she was an athlete and she was really chatty also during lesson, the teacher told her if she hadn't been prepared at the exam, she would have been, she had to repeat the year, she would have failed. So this kind of aggression that had a really strong impact on her created such a strong conflict in her that caused these problems that wasn't codified within her and non-logic. But this happened, this was real, and the next day when she woke up, the system retraced all the pain she had, and then she was purified again. She went walking again and riding a bicycle. So you see, so we have an impact on a physical level, but the origin is really different and far away. So we cannot use normal techniques to dampen an effect, to make it silent. But and we cannot silence it, because when we close it, it will go out another way. So the system had to find another subtle strategy to hide this pain another way. Is that clear? Okay. How can we say that emotions don't deal with our posture and that they are interconnected? It's not like that. Just see this picture. After all, posture isn't just biochemistry and trauma. When you see an aggressive person, she has a determined posture. And also a depressed person has a different behavior. Posture comes from a balance from what we are inside and outside. And therefore, talking about posture, we cannot forget about diaphragm, because that plays our muscular chains. And for this reason, it is always present in our work. The global postural approach for the real balance has many factors we will see now. These postures have the power to interview the muscular chains. When we put a person in a specific way, we see the reactions. We trigger a breathing technique in a certain way, specific way, and that must be relaxed. Because when I asked you before to listen what I was saying, you didn't do, and then you listened, but you inspired. Inhaled. After having stress, you blocked yourself. So you held your oxygen to last longer and to face the situation. So when there is an aggressive phenomenon, you organize yourselves, you close yourself to run away, for example. And therefore, we organize ourselves also in our posture. When we interview these chains and we tension them, put them in tension, and we free our diaphragm, that I tell the system, you don't have any risk now, so you can just let it go. What would you say mean? So without any worries, there is a breathing technique. The diaphragm is relaxed, and ancient memories, old memories pop up. And the patients tell us what he has never told us before. At the end, he will always tell us, I've told you something I never told anybody before. And this is because they were able to they were disarmed, so they were able to tell us everything. Muscular chains so have emotions, culture, also food. We've heard that this morning, food and its components, trauma, habits, viruses, and for that they have the power to influence, shape, and model our posture and our mood, and also in reverse. So posture tells about our experiences, our culture, and our life. We are our history. And our history has formed us, but our life is deforming us because we are acquiring habits. If I told you about what I was seeing in the 70s and 80s in the young athletes and what I see now in the 21st century, the habits are really different. They are still, their spine has changed. Our cells adapt themselves. What can we gain and achieve? Often things seem impossible to change, but it isn't so. Here is an example of a 72-year-old man that after 12 sessions, there are changes. I will tell you very quickly about that. We see the barre vertical here, that is the white one, and we see the masticatory axis and the differences in the cervical line. We see that here and here. The changes are really important, and this is after 15 sessions. He is a volleyball player. This young is a volleyball player and an athlete, and that happened to him as well. Yeah, often you go to the gym to tone up your muscles, but it's not like that. You have to elongate your posterior axis. You see the difference here. We're not talking about a static posture. It's a good posture. And this is a relationship among the different parts of our body. Also here you see the differences. Legs here can undergo modifications. Of course, this is valgus knee. The starting measurement was 28 centimeters, and after different sessions, we have 13 centimeters just in 3 sessions. That was a case used for a congress. And I didn't even finish the work, but we reached this point. Here is 14 sessions. Here is before, how the knees were. And here is valgus knee, and here is the difference. Stabilometric platform, here to be more specific. Here you see our upper part. Here are all the parameters, but I will go on that. Here the genial recurvatum could be modified as well. We worked also on her feet because she had hammer toe. So usually you go and treat that part, but we treated her upper part. Here is the lingual chain, the tongue chain, and hallux valgus. This patient, we treated her tongue, and her hallux valgus improved. What relationship is between tongue and toe? There is a specific chain which has an incredible power, and we can see that here because chains are in theory. You can see that every day. This man holds part of a pig, and we see here the tongue, and we have a continuity of chain, which is the tongue chain, and everything is linked, as you can see. Up down to the feet, it has an incredible power. Vitiated positions, because in the mouth, for example, there is galvanism because of metals, for example. The lingual chain has a change, and the changes hit the diaphragm, the knees that are varus or valgus, or, for example, even down to the hallux valgus. Here, this young girl was treated on the tongue chain through pancafit. We see that better here, beginning, middle, and end session. You see how the knee changed in 8 months. You see also her back. See her stomach. There are incredible changes just because we have perturbators in us. For example, there are also swallowing issues just from the infancy through the pacifier. Here are the bases of our approach. What are our bases? We use the laws of posture. What are they? There are balance through the vestibular system, eyes, foot, and gravity. We want to stand up, and then we want to function through muscles, chain muscles, and so on, so that I can breathe, eat, sleep, have sex. And we want to do that with the smallest outlay of energy. Possibly, I don't want to feel pain because we want to project ourselves towards life. In a dual world, the death and life go in opposite ways. So This dual phenomenon creates pain and no pain. But fundamental elements are these. We all need to breathe, sleep, and eat, economy, and non-pain. These three laws change according to our priorities. Do we need, are the needs in the first place economy or maybe no pain? We think, I want my house, I want this, I want that, I want to eat so that I can feel better. And if I feel kind of pain, it's okay. But that's not like that. The central system puts in the first place the no pain, then economy, and at the end, we have the needs. This changes everything regarding muscular chains, and therefore also therapies that are normally used to suppress pain. If you don't feel pain, you don't suffer. But I don't think so. I have to discover why there is some pain. I have to find the roots of the pain, and then they will be eliminated and defeated once and for all. And I think this is the most important aspect. Let's examine this man. He's an engineer, 82 years old, really smart, and construction worker. We thought he built that because it's really alike. His posture is unbalanced, and so we suspect that he has pain. And I asked him, do you feel pain? And he was like, shocked. And he was like, no, I don't feel any pain. And I was like, how come you're here? And he told me I have some difficulties. So we investigated him, we examined him, and we found out that he didn't feel pain. He just felt pain once in his life while working, but he never felt pain anymore in his life. And he always keeps fit, walking around the neighborhood until he finds out he cannot walk anymore. He has to stop and start walking again until he comes back home. What happened? His antalgic system, that is the system against the pain, told him basically, don't worry, just maintain this position. I do like that and like that. I am in balance. I don't feel pain. I am stable, and who cares? Because body will say here and now, I find the solution here and now. So if I'm crooked, it doesn't think like if I'm crooked, what will happen in the future? There is no such question. And this is what happened to him. But holding this position in an antalgic position, he consumed his energy, so he was really stiff, so that he couldn't even adapt or walk anymore. So what did we do? We analyzed him on the platform, and we analyzed his core, his barycenter. He organized himself, the body organized so well among foot, the hips, the arms. It was incredible. Just as an engineer, this system is so incredible because it was the most economic. If it was unbalanced, it couldn't even stand. And this is the body intelligence that has a price. So why did he come to us? Because he told me he couldn't walk anymore. Because putting so much effort in not feeling pain couldn't allow him to walk anymore. The central system, the TPS, follows the ancient input of no pain, and this to the detriment to any function. Pain is a smart warning sign that tells us when something is not working. Not having pain, he thought he was fine. When I look at him, he was crooked, and he asked me, what do you mean? And I thought, he's an engineer. He's really smart. He's really active. It was incredible. 82 years old. He was genius. But the proprioception was zero. Since pain is a smart warning sign, I ask you, is it better if the body can hide pain, as in this case, or is it better if pain is still active every day? What would you like better? Pain is an enemy or a friend of posture? There are many answers and two different questions. Pain is a priority because this signal is a threat to survival. For the body, the pain is equal as death, and this is why there is no pain. It is the worst enemy for posture, but the posture is an enemy for functions and well-being. The pain has the power to reduce our living space. And the philosophy of our system is that it is better to be crooked than in pain. But if we are crooked, there are also different joint performances. And so we will have pain, physical breakdown, and also depression. And if we lose our freedom to move, such as that motorcycle, we also lose the possibility to adapt ourselves. Survival is the ability to adapt to new situations. So if I don't have this possibility anymore, I can't live anymore. There is another shade that is beyond pain, that is the same for food intolerances and allergies. And this is the silent irritative disturbance to the spine. And this is the list. Psoriasis, dysbiosis, food intolerance, occlusal minus plus. And that is when the teeth touch each other. Galvanic current in mouth. When you have implants in your mouth, and you have a galvanic current in your mouth, we will see later. Tongue tension, short lingual frenulum, atypical swallowing, unilateral chewing, neurological tooth, reactive scar, and all trauma. Pain is a declared enemy, and the irritative spine is subtle, is the worst enemy. And as it was said many times, we have intestine with all the components of disturb and dysbiosis. When there is phoria, so the eyes aren't parallel, we have altered occlusion, these dislocations, and we see that from the infancy on. And we have this kind of tug when the tongue pushes against the teeth. And here I'll show you an example for irritative spine.
Non parte l'audio, ma questi bambini stanno parlando in casa. I genitori mi mandano questo filmato preoccupati perché
sent this footage because her daughter is moving her hands and they don't know why. And she comes to the praxis, to our praxis. The volume isn't working, so I can explain it to you. Okay, I move it like that. What happened before you had these uncomfortable feeling in your hands and neck? For example, did you go to the dentist? What did you answer me? Yes, he put enamel on my back teeth to avoid tooth decay. Yes. They put this enamel. So what happened after that? My lower jaw muscles kept on doing like this, and they hurt. To avoid annoyance, how long did you feel like this? A few weeks. Okay, after the annoyance disappeared, what started bothering you? The neck? I kept cracking it. And how long did you feel like that? Like a few months? And after the neck pain disappeared, what started? My hand went like this. How can you show me? Okay, so we had a treatment, and what happened? I treated your neck, and the pain went away from your hands, but then the neck pain came back. Do you remember? Yes? Then I asked you what lied behind, and you remembered about my teeth. Yes, the dentist, very good. So during the clinical examination, Sophia and her parents didn't remember anything that could explain all her pain. Chronological investigation of the causes. And 1 year ago, treatment against caries. Some weeks after, the uncomfortable feeling in the neck starts. It lasts a few months. Go forward so we don't waste time. So, a little more attention. So this girl, since she went back to her practitioner, we did a good work. So we act in a different way, and we act on her system. So the system could be plastic and would adjust. We understand the logics of prevention, but sometimes we need something else, and we do bad sometimes. This patient arrives in this way at the beginning. There is a footage, but we don't have time for that. She says, when I had breast surgery, after 2 weeks, my tongue wouldn't fit in my mouth. So nobody would understand me. So we treated her scar, and at the end of the session, the last photograph was that. So what's the relationship between the tongue and the scar? Because the body is one, it's a fascial problem, not just muscle chains. And fascial are wider than chains, and they talk with all the systems. Sometimes uses this type of systems. This is the tongue. There's a big arch, and this amalgama emits current, and the tongue created a defense. This is an interesting footage. I think it's amazing. We're doing training to professionals, and there's girls with a retainer, with a dental splinting, and we measure the galvanic currents, and there are 126 volts circulating in the mouth. So there are more tests carried out. So we know that this disruptor is multiple. But let's see the measurement we do right now with piercings or earrings or medals in her body. Can you tell us what you do with your tongue? Where is your tongue? On the braces. Always on the braces. When we have braces, the tongue tries to exclude the external body, the unwelcomed. I felt everything on the right side, formication, the whole right side. Shoulder, cervical, hand, teeth, legs, everything. So this phenomenon, through this and the earring, activated a neurological breakdown, blackout, and this is something that we do unawarely every day. So what did you feel? Tension. Where? Where the tool was. I felt a shock. Now we measure the piercing. We couldn't see that really well. It's not disturbing that much. Now we try on the ring. I don't remember how much, but it was quite important. But on the arm was quite important. The scars are a severe interruption of our skin, capable of big perturbations. But maybe here we can figure out something. 1 minute, I skipped something. So this footage, the probable cause. She has a pain at the groin. When did you have the laparoscopic procedure? 10 years ago. So she tells us. She breathes. And with a finger we perturbate the scar. 2 minutes are enough. It makes me want to cry without doing anything on the whole body. She stands up, the pain disappeared, and she bends. As the pain disappeared, as that their parents were divorcing, so it was a difficult period. So look at this feet. This girl from Bergamo, and the dad said they want to operate. What do? We investigate, and we found out that her belly button is untouchable. It's painful. So we treat the scar of the belly button, and this is the result at the end of the session. How is that possible? That for an intelligent mechanism, phenomena like that come out. It's not important. Such phenomena exist. I barely believe that, and I imagine you. So these perturbators activate defense system to escape pain through the enhancement of the muscle chain's tone. So at the end of my life, avoiding pain, I'm all crooked. Every pathological enhancement of the tone brings to an hypertonia of chains. What does the compensate mean? If someone comes to me and is crooked, I put him in an upright position so he or she doesn't feel pain. Through obviously adequate technique, and we arrive to that position, to the right position, to loosen the knots of the chains, and to give back the joy of living. And this represents the reality of what I'm saying. Here we are at the training session for our method. One of the TMJ tests in relation to muscle chains. These are the initial postural exam. There's a plumb line at the center. She is a bit crooked. She has TMJ problems, and she complains about that. So we carry out a test. Open your mouth, don't open your eyes. You stay put because your eyes are open. Then we say, let's continue. But open your mouth a bit wider, and let's see what happens. Then open wider, even wider, a little more. And then she says, oh my God, I was falling. And then we started treating her. Where should we act? How to intervene with Raggi method? We put her in a decompensated posture. We ask her to breathe. It's a bit complicated though. She keeps the upright position, the right position, against her antalgic systems, and we wait for something to happen. There's a small TMJ treatment. There's a neck stretching treatment. So lose your thorax, let the air go. And after after breathing, she felt a tension in the neck. So the colleague said, okay, let it go, something more. And something is coming up. She starts feeling tensions stretching. She goes on, and tension arrived to the leg. And she doesn't remember about an old trauma. And after 4 or 5 minutes, there's no reactions, no more reaction, and they finished. She stands up. We carry out the same tests, the same plumb line, the same positions, again with the closed eyes. And once again, mouth open. Just see what happened. At the beginning, she's going on the other side. She lost. There's a reset, and she realizes that something has changed. So and afterwards she had no pains, no problems. So her pain was defeated. So the TMJ, tension and discomforts, move along the chains to recreate a new balance. So the logic of the method, using the compensated posture, you force the hypertonia to emerge. The postural rebalance at global approach looks for old causes as effect as causes. So to restore harmony and freedom. Thank you. I still have 2 more minutes. Yeah, my clock is there. Okay, now let's see how pains work, and information, problems, pain move along the chains in a difficult path, non-linear. Don't expect that a problem on the foot finishes on the foot, because it can become a pain maybe in the stomach and the hand, and then maybe you will have headache, maybe a headache for dysbiosis, etc., etc. My aunt used to say, where you find the effect, you don't find the cause. Most certainly. One of the fundamental steps for us posturologists is that we know that we don't know. Because if we assume to know why the patient is sick, it's the end of the treatment. And only the reality hidden in his tissues is the real cause. We don't need to interpret, but to analyze, understand, and bring the real story alive. So the goal of this method is to give the person back their dignity, the freedom from pains, discomforts, help the person to regain pleasure and to go back and live. If you need information and you want to see more videos, if you go to the website, you will find more videos. And if you want, we brought some abstracts of thesis. And if you want some more pieces of information, etc., just I could talk to you about many works at La Sapienza, and we saw what happens to people using specific breathing techniques and see how people change. We did that in Switzerland, and we noticed really interesting changes. It's about miracles? No, it's just all normal changes in the posture. So thank you for your attention, and this is me, Daniele Raggi. So when the light speaks, the wisdom silence. I don't think I can say more to talk about Professor Raggi, who explained the love, his love, his passion for what he does to relieve people from pain. He's been doing this for years, and I forgot something. He designed Pancafit. He's the inventor of Pancafit. So the bench you saw that help people to find the right posture, the right balance. So that's why I call him Magic Raggi. So did you figure it out now?
Sotto c'è uno schermo, vostro